I've been working with OHLC for a number of years in my capacity at Care Oregon as the Government Relations Director. We've been working to expand healthcare to all people who live in Oregon and had a lot of success in the previous years in expanding to all kids, but we hadn't included the populations of kids that weren't citizens. So I had a chance to work closely with the Executive Director of the Oregon Latino Health Coalition, with the staff, to try to first pass what was called CALM, which gave children who are going to be born in the United States to moms that weren't U.S. citizens a chance to have a safe birth and to be covered in that process of the first month or two of life. But we didn't feel like that was sufficient. We really believed that healthcare should be for all people. So I had been working closely with the staff and the organization to get healthcare for everybody who was a resident in Oregon. And I was asked by the executive director to join because I was working closely enough with them that I understood the issue, the partner organizations, the legislators. So for me, it was an opportunity to express the commitment that Care Oregon had to all citizens getting health care by leaning into an organization that was really at the front end of making that possible for all people who are living in Oregon. I believe that healthcare is a right, that we are still in this country and in this state working to express that right to all of the people who live here. And I believe that the fight for health equity is a fight for people's rights. The Oregon Latino Health Coalition is at the front end of that fight, specifically for people from a Latino background, but more broadly, when we get health care for all people who live here, we don't say it's just for all of the Latino people. It covers everybody. So we expand that civil rights fight more broadly. So there's an intersectionality in the mission where we're fighting for civil rights for all people by fighting for the civil rights of Latino people. I mean, a healthy community is one that stops relying on the healthcare system to intervene when people get sick. A healthy community is a place where we have families that support one another and do so in a sense of community, where the school is a center for health and wellness, the community center, the park is a center for health and wellness, the neighborhood association is a center for health and wellness. That we've taken the commitment to living well upstream from the health system and into our lives and our communities and our neighborhoods and our families. I think it'll be expressed over time, and people will shop and eat different foods. We'll go to different restaurants. We'll attend more social gatherings. We'll have opportunities to help parent one another's kids, and that kind of community is one that, frankly, our culture has a lot to learn from many of the cultures that the Oregon Latino Health Coalition works with. So my hope is that one step in the modern world for a healthier community is to look into our past and say, what were the things that made us healthy once upon a time?